ഇന്ന് ലൈഫ് ആൻഡ് ഹെൽത്ത് സെഗ്മെന്റിൽ നമ്മുടെ വിഷയം പക്ഷാഘാതം അഥവാ സ്ട്രോക്ക് ആണ്. എന്തുകൊണ്ടാണ് പെട്ടെന്നുണ്ടാകുന്ന ഈ അവസ്ഥ? എന്തൊക്കെയാണ് പ്രതിരോധിക്കാനുള്ള മാർഗങ്ങൾ? നമ്മുടെ അതിഥി ഷിക്കാഗോ നോർത്ത് വെസ്റ്റേൺ ഡെലനോർ ഹോസ്പിറ്റലിലെ ഡോക്ടർ ധ്രുവിൽ പാണ്ഡ്യ. ഷിക്കാഗോയിൽ നിന്ന് ഡോക്ടർ സിമി ജെസ്റ്റോയുമായി നടത്തിയ അഭിമുഖത്തിന്റെ പ്രസക്ത ഭാഗങ്ങളാണ് ഇനി.
സ്ട്രോക്ക് എന്ന് കേൾക്കുമ്പോൾ തന്നെ നമുക്ക് എല്ലാവർക്കും പേടിയാണ്. കാരണം സ്ട്രോക്ക് വന്നു കഴിഞ്ഞാൽ നമ്മുടെ ജീവിതം തന്നെ മാറി മറിയും. വേൾഡ് ഹെൽത്ത് ഓർഗനൈസേഷന്റെ കണക്കനുസരിച്ച് 15 മില്യൺ ആൾക്കാർക്കാണ് ഓരോ വർഷവും സ്ട്രോക്ക് വരുന്നത്. സാധാരണക്കാരായ നമ്മുടെ സംശയങ്ങളെല്ലാം മാറ്റുവാനായിട്ട് ലൈഫ് ആൻഡ് ഹെൽത്തിൽ ഇന്ന് നമുക്ക് അതിഥിയായി എത്തുന്നത് US-ലെ ടോപ്പ് ഹോസ്പിറ്റൽസിലൊന്നായ നോർത്ത് വെസ്റ്റേൺ മെമ്മോറിയലിലെ ന്യൂറോ ഇന്റർവെൻഷനിസ്റ്റ് ഡോക്ടർ ധ്രുവിൽ പാണ്ഡ്യയാണ്. He is a board certified internal medicine, neurology and neurocritical care. And he's also a fellowship trained in internal neurointerventionist, as well as he's currently doing a fellowship in integrative medicine for lifestyle medicine. So let's welcome Dr. Pandya to Asianet USA.
Thank you very much, Simi, for having me. I'm excited to share my passion with everyone today.
And might as well, we are so happy to have you here. So let's start about what is, in simple words, what's stroke and, what's the importance of identifying stroke early?
Yeah, no, that's a very, very good question. Stroke, as some people may think, involves heart, but stroke actually involves the brain. I'm sitting right in front of me here an example of a brain. And it occurs when you have a lack of oxygen to the brain. It causes damage to the brain, causing an irreversible injury. There are two types of stroke that we want people to know about. The common one is what we call an ischemic stroke, which what it means is basically there's a blockage of a blood vessel that causes lack of oxygen. The second one is a brain hemorrhage. I think that's the common term that we use in India, and it's basically bleeding within the brain or around the brain. Stroke is very important because it's number one cause of disability in across the world, actually. And why that is important is our quality of life, what we do every day, talk, walk, is very important to us. And when you have a stroke, that impacts that. It's a 5th leading cause of death in the United States, so it is associated with mortality or people dying from it. And it's very, very costly. It costs our economy $350 billion to treat someone with strokes. And most importantly, why we need to worry about stroke is it is preventable. I think we need to learn about stroke to make sure we can prevent it.
So I have heard like every 40 seconds someone is having a stroke. How can the family members or a friend, or if you're going outside, how do you identify, is this is a stroke or not?
In the past, we used to think that stroke is not reversible. But now we know it's reversible. But the most important thing about stroke is you have to get treatment early enough. In order for you to get treatment early enough, you have to get to the hospital early.
I mean, how can people know which hospital they should go? That is always a concern. So hospitals have a stroke facility or not.
So I think first thing first is I think people should be aware of what are the symptoms of stroke. And the common mnemonics we use for that is called B fast, where B stands for any sudden onset of balance problems. E stands for eye, so any sudden onset of vision changes, whether it's double vision or blurry vision. F stands for face, so any problem with face, where you have asymmetry or weakness, numbness. A stands for arm, so any weakness or numbness of arm on one side or the other. S stands for speech, so any problem talking or having slurred speech or unable to understand. And T stands for time. If you or your loved one have symptoms of stroke, the most important thing is to call 911 first. So the nice thing about that is that the patients or the community doesn't have to worry about where they should go. You let the EMS decide where they should go. They just have to make sure they recognize the symptoms of stroke.
At least they should tell the first responders that we think, this is probably a stroke or what are the symptoms, so they know, right?
Absolutely. I think that's a very, very important point because a lot of times they call and not not
Yeah.
know what's happening. But if you let the other side know that, hey, maybe someone's having a stroke, the process moves a lot faster. Because we understand as a provider how important the stroke is and how important the time is. Each minute we can save 2 million brain cells, and we move this process very fast.
Coming to the different types of strokes, there are strokes because of the blood clots or bleeding related, as well as the blockage of the vessels. So, is there anything different in symptoms?
No. Actually, you don't know what type of a stroke you're having from symptoms. A lot of people think that headache is a sign of only hemorrhagic stroke, but that's not actually true. Even with the patients who have a blockage of the blood vessels where there is a ischemic stroke, they also can have headaches. For example, when you look at this brain, there is an area that you see it looks damaged compared to the surrounding of it. There's a dense area and there's a loss of brain in that area. When you look at the brain scan on these patients, maybe 3 months down the road, they both look exactly the same. So in order for you to know what stroke someone is having, you have to get to the hospital, get a CAT scan, and that's the only way we can tell you.
So, you mentioned about stroke is reversal, and the time is very valuable. When patients are having symptoms of stroke, what are the technologies in this 2020 to reverse stroke?
Yeah. Stroke has evolved so much. Actually, the stroke treatment has evolved so much where we can truly say that we reverse stroke. And again, it's important for me to stress that the timing is very important. If you get to the hospital within 4.5 hours from onset of your symptoms, that means when your symptoms started, you can receive a clot busting medication called TPA. People who receive TPA, 30% of them can have reversal of their stroke. Now, with the advancement in technology, with catheters like this, if you are having a big stroke, where if you have a major blockage of your blood vessels in the brain, there are certain hospitals that can offer you a minimum invasive surgery to reverse your stroke. And this is what I'm referring to is for an ischemic stroke where you have a blockage of the blood vessels. And that technology is basically doing an angiogram, going through your groin area, using pipes like this, using an x-ray, going to the brain, where there is a blockage. We put a device like this, it's a stent, where we put a device through the clot and remove this device to get the clot out of the brain. What this does is it reverses the stroke, restores the blood flow back, and the brain gets the oxygen it needs. Again, the most important part of this, even though it's reversible, to get to the hospital as soon as you can.
As far as for people who are like layman language, they know that there is a blood clot or cholesterol deposit, something blocked the vessels and caused it. So in diabetes and in stress, it's like a common question I hear too. How does that causes stroke?
I think what we're learning, and this is all kind of evolving, is because if you have a diabetes or high blood pressure or high cholesterol, or you're smoking cigarettes or drinking excessive alcohol, you have this visceral obesity, it affects your blood vessels. It affects your blood vessel walls. And there's thoughts about that causing inflammation within those blood vessels wall, and that leads to stroke. Because what happens to your blood vessels? Because of it causes this injury, a damage to your blood vessels.
So after stroke, what are the recovery process? What somebody should expect?
Yeah, no, and recovery is a big part of stroke. As I mentioned before, that it's a number one cause of disability. So people who have stroke, they have some sort of a physical disability. They have some sort of a mental disability. We see a lot of depression, anxiety, post-traumatic stress disorders. And there is a huge burden on a caregiver. But the good news is that everybody recovers. And that recovery really depends on how much work the person puts in, how much they work to get better. After a stroke for recovery, you should expect physical therapy, occupation therapy, speech therapy, maybe a mental health counseling, and a lot of work from your end for you to recover back to your baseline. Now, not everyone can recover back to their baseline, but you have a big potential of recovering depending on how much work you put in. We commonly say that your recovery occurs maximum up to 1 year, but I'd be lying if I told you that that's true, because I think I see that recovery happen for life. I have patients who recover for their entire life. But there is a big aspects of your physical and mental that impacts your after a stroke.
Thank you so much for coming to Life and Health Show of US Weekly Roundup, Dr. Pandya, and we hope to see you soon for different other topics.
Thank you very much. Good luck.
ശാന്തിഗിരി ചർമ്മശുദ്ധി ഹെർബൽ സോപ്പ് ഉള്ളിലെ ശുദ്ധി ഉടലാകും.
Joseph CPA, Ruby Group Accounting and Tax. TC Chaco Organization builds millions of dollars in prime real estate.
Dhruvil Media is there to capture your unforgettable life stories for you.